Hello, future psychologist. Welcome to Dipenism. I'm Dr. Dipen Shah, and now we are going to discuss the seventh chapter of psychology from HSC Maharashtra board. And the seventh chapter is a very small one. जिसमें discuss किया गया about first aid in mental health. तो जैसे हम लोग कभी कोई इंजरी हो जाता है तो फर्स्ट एड यूज करते हैं कि कैसे हम लोग वो इमरजेंसी सिचुएशन में कैसे उस पर्टिकुलर टाइप के इंजरी को या डैमेज को हम लोग मैनेज कर सके, कंट्रोल कर सके। वैसे मेंटल हेल्थ को मैनेज करने के लिए कुछ फर्स्ट एड मेजर्स यहाँ पे डिस्कस किए गए। सो व्हाट इज द नीड फॉर फर्स्ट एड इन मेंटल हेल्थ? एक एलजी करके मॉडल है। दिस इज गोइंग टू बी द वेरी इंपॉर्टेंट क्वेश्चन फॉर योर बोर्ड एग्जाम्स, एलजी मॉडल। फिर फर्स्ट एड डिप्रेशन में क्या हम लोग को यूज कर सकते हैं, एंजाइटी के लिए क्या यूज कर सकते हैं, और कुछ बिहेवियरल इश्यूज जैसे कि इंटरनेट एंड सोशल मीडिया यूजेज पे डिस्कशन होने वाला है। सो टू बिगिन विथ, नाउ if you found making the second list harder, do not worry, you are not alone. Now second list मतलब यहाँ पे एक एक्टिविटी के बात की है, that make a list of activities you perform to take care of your physical health. फिजिकल हेल्थ मेंटेन करने के लिए क्या एक्टिविटीज करनी चाहिए? तो एक्सरसाइज करना चाहिए, डाइट होना चाहिए, अच्छी सी नींद होनी चाहिए, जिम ज्वाइन करो, रनिंग करो, साइकिलिंग करो, स्विमिंग करो। नाउ मेक अ लिस्ट ऑफ द एक्टिविटीज यू परफॉर्म टू टेक केयर ऑफ योर मेंटल हेल्थ। डिस्कस द टू लिस्ट इन योर क्लास। मेंटल हेल्थ मेंटेन करने के लिए क्या करना चाहिए? तो काफी बार ऐसा डिस्कशन ही नहीं होता। नाउ मी बीइंग अ साइकोलॉजिस्ट, मुझे पता है कि हाँ यार क्या क्या एक्टिविटीज मुझे मेरे पेशेंट से करवानी है, बट इन जनरल काफी लोगों को पता ही नहीं रहता। तो ये चैप्टर आपको वो कुछ ऐसे आइडियाज देंगे जिससे आप लोग अपना मेंटल हेल्थ स्टेबलाइज कर सके, मेंटेन कर सके, इवन इन डिस्ट्रेसफुल सिचुएशन। How many things could you list? Did you find out making one list easier than the other? Yes, if you found making the second list harder, जो mental health के लिए है, do not worry, you are not alone. We are usually aware of what we need to do to take care of our physical health, but we are unsure of how to take care of our mental health. As children, our parents always tell us, what we need to do in order to lead a healthy life. Usually this advice is about the behaviors we should adopt in order to stay healthy. For instance, before exams, they might tell to eat food that has been cooked at home, get adequate sleep, सुबह जल्दी उठ जाना, रात को जल्दी सो जाना, मोबाइल ज़्यादा यूज मत करो. This is done to make sure that you do not fall sick during the exams. These are some of the preventive measures that are taken to protect the body's immune system, which might already be compromised due to the stress of the examination. So we all agree that our physical health is important. Do you think our mental health is any less important? It is in fact more important because there is mind-body relation. हमारा mind क्या सोचता है, accordingly हमारे body पे उसका effect पड़ता है. How much care do we take of our mental well-being? इतना हम लोग time देते हैं हमारे mental well-being को. फिलहाल आज की fast-paced life में हम लोग physical health पे भी ध्यान नहीं दे पाते. Mental health तो दूर की बात है. So look at the given box below. Mental health statistics in India. According to study conducted by NIMHANS, National Institute of Mental Health and Neuroscience, NIMHANS का full form पूछ सकते हैं, National Institute of Mental Health and Neuroscience, from 2014 to 2016 gave a statistical analysis. 10% of the population suffers from common mental disorders. 10% of the population. 10% is not a small number. हमारी 100 करोड़ की आबादी में 10% मतलब बाप रे, 10 करोड़ से भी ज्यादा लोगों को मेंटल डिसऑर्डर्स है. 1.9% सफर फ्रॉम सीवियर मेंटल डिसऑर्डर्स and 13.7% of the Indian population will at least once in their lifetime be diagnosed with a mental disorder. So itna higher statistics hai. So it is important to remember that even if one isn't diagnosed with a mental disorder, stressors of daily life such as pressure at work or studies, overcrowding, lack of social support can all contribute to poor mental health. तो previous chapter में हमने mental health और mental illness के बारे में डिस्कस किया था और mental wellness के बारे में डिस्कस किया था. So mental health first aid, MHFA, is an internationally recognized training program designed to teach people how to identify the signs and symptoms of mental health and provide assistance on a first aid basis. So mental health का अगर maintenance ना तो उसके लिए there is this program. MHFA course was originally developed by Betty Kitchener. Betty Kitchener, a registered nurse specializing in mental health education, and Anthony John, a professor of psychology in Australia. तो बेटी किचनर एंड ये एंथनी जॉन ने MHFA शुरू किया, मेंटल हेल्थ फर्स्ट एड. सो So need for first aid in mental health. As we have seen, many individuals in India can benefit from mental health first aid. Unfortunately, many do not get the help they need due to various constraints. Some of the hurdles to receive treatment is lack of knowledge. लोगों को पता ही नहीं mental health जैसी कुछ चीज भी होती है. Lack of awareness. उनको पता ही नहीं कि ऐसा कुछ option भी है जिससे वो लोग अपने mental health को manage कर सके. Cost of the treatment. Non-medical explanations for mental illness like evil spirits, black magic, etc. Shortage of trained mental health professionals, unwillingness of the individual and the family members to get treatment due to the social stigma, untrained individuals giving wrong advice, slow improvement in the individual's behavior. So, ये सब reasons हैं. So, some of the reasons why first aid in mental health is required is stigma associated with mental illness. This is one of the major obstacles to getting help from a mental health professional is the stigma that is attached to mental illness. We fear things we do not understand. In the same way, our lack of understanding of mental illness makes us fear it. This lack of knowledge and awareness makes us blame the individual, think that mental illness is a personal feeling or weakness. It's not a personal feeling. मैंने psychological disorders chapter में भी अपना short में story share किया था कि yes, I have been through a phase of depression. So initially I used to feel कि यार लोग क्या सोचेंगे, but later on I realized I need help. I need to come out of it, and I broke that stigma. So ये हम पे है कि हम कैसा हमारा एटीट्यूड रखते हैं. सेम में दूसरे सामने वाले पर्सन को जिसको ऐसा कोई मेंटल हेल्थ का इश्यू है, उसको भी हम लोग कंफर्टेबल फील कराए कि बॉस देयर इज नथिंग रॉन्ग इन इट. जैसे बुखार आ जाता है, सर्दी जुकाम होता है, इन्फेक्शन होता है, वैसे ये टाइप का कंडीशन है जिसको मैनेज किया जा सकता है. थिंक दैट मेंटल इलनेस इज कॉज्ड एज पनिशमेंट फॉर आवर सिंस. ये तो बहुत ही वाहियात सोच है कि यार हम लोगों ने पाप किए इसके लिए हमारा मेंटल हेल्थ डिस्टर्ब हो रहा है, ऐसा कुछ हो रहा है. Think that the person is intentionally behaving in an inappropriate way. जानबूझ के वो ऐसे सब नाटक कर रहा है, ड्रामा कर रहा है. So काफी बार ऐसा होता है कि वो उसका पैटर्न ऑफ बिहेवियर हो जाता है, बट उसको वो ब्रेक करना है. So second obstacle is shame. When a person experiences shame, he or she tries to hide from others. For example, if Jay fails in his 10th standard board exam, his academic failure is considered to be an act that brings shame not only to him but also to his family. As a result, they withdraw from social interactions. When we experience shame, we do not want to talk about it. It prevents us from reaching out to others, and therefore we do not seek help. It is important to remember that mental illness is caused by complex combination factors like genetics, socio-cultural factors, environmental factors, etc. So it is never caused because of personal weakness. तो इसमें कोई personal failure नहीं है, कोई personal weakness नहीं है. यहाँ पे एक डायग्रामेटिक रिप्रेजेंटेशन दिया, एनिमेटेड इमेज दिया हुआ है. एनिमेटेड तो नहीं है, बट ये कलरफुल इमेज दिया हुआ है कार्टून कैरेक्टर्स के टाइप में, सो दैट इट मेक्स थिंग्स मोर इंटरेस्टिंग. इट इज नेवर कॉज्ड बिकॉज ऑफ पर्सनल वीकनेस. मेंटल इलनेस इज नॉट बिकॉज ऑफ पर्सनल वीकनेस. Thus blaming the individual who has been diagnosed with a mental illness is not helpful. Instead, it will be beneficial to provide support and show understanding towards the individual. So ये एक रीजन. पीपल डू नॉट ऑलवेज नो हाउ टू रिस्पॉन्ड, और ऐसा मेरे साथ भी काफी बार हो रहा था. सो लोग ऐसा बोलते हैं अरे ठीक है ये बात को जाने दे, भूल जा, बट जाने दे नहीं. ऐसा बोला जाता है कि लेट गो करना है, लेट गो नहीं करना है. मोस्ट इंपॉर्टेंट थिंग एनीथिंग इन लाइफ इज एक्सेप्टेंस. उस चीज को एक्सेप्ट कर लेना, और बोलने में और एक्सेप्ट करने में बहुत फर्क है. इट टेक्स लॉट ऑफ टाइम टू एक्सेप्ट अ पर्टिकुलर फैक्ट ऑफ लाइफ एंड नॉट टू बी अफेक्टेड विद इट. इनफैक्ट उस इवेंट को याद करके आप लोग अपने इमोशंस को न्यूट्रल लेवल पे ला चुके, अभी वो नेगेटिव भी नहीं है, और बाद में धीरे धीरे अगर उससे कुछ पॉजिटिव आप लोग ट्रांसफॉर्मेशन ला पाओ, बेस्ट थिंग. जैसे मैं ट्रांसफॉर्मेशन ला पाया, आई वेंट टुवर्ड्स द फील्ड ऑफ साइकोलॉजी, मैं और स्टडी करने लगा, अंडरस्टैंड करने लगा. सो एक्सेप्टेंस इज वेरी इंपॉर्टेंट. सो ऑब्स्टेकल्स क्या कहते हैं, तो एक तो है स्टिग्मा, दूसरा है शेम, एंड दूसरा है रिस्पॉन्ड कैसे करना, वो लोगों को नहीं पता. We really want to help our friends who come to us for advice, but we aren't always successful as we do not know exactly what to say. In these cases, we might do more harm than good. Let us see the case of Amit and Shyam. तो ऐसा एक example दिया गया है. My elder brother, whom I am very close to, will be going abroad to study. Maybe talking to my best friend Shyam will make me feel better. And फिर वो बात करना शुरू कर देता है. Why are you feeling so sad? It's not a big deal. Look on the bright side. You've got to spend time with him for so many years. I don't even have any siblings. You should feel happy that you have one. You will feel perfectly okay after a few days. दोस्त से उसने हेल्प मांगने आया है, मतलब अपना इमोशन शेयर कर रहा है, और उसने बोला एक क्या छोटी मोटी चीज के लिए रो रहा है, एंड द फ्रेंड स्टार्टेड टू फील, जिसने शेयर किया, मे बी इज राइट, आई एम सो स्टूपिड. So here we see that people do not always know how to respond to someone in distress. Instead, if Shyam responded in the following way, it might be helpful. I can see that you are feeling sad since your brother is leaving. I know it is a hard thing, hard thinking about being separated from him. Hard thing to think about being separated. I hope you know that I am always there if you want to talk. Yes, तो ये एक acceptance दिखाया एक friend ने, अनकंडीशनल पॉजिटिव रिगार्ड दिखा. ये ह्यूमनिस्टिक साइकोलॉजी का बहुत इंपॉर्टेंट ये एक लॉ है या फिर ये कंपोनेंट है, अनकंडीशनल पॉजिटिव रिगार्ड. सामने वाले को बहुत ही पॉजिटिविटी देना कि नो प्रॉब्लम, आई अंडरस्टैंड. और शायद हम हर इंसान अलग अलग तरह से, किसी के लिए कोई एग्जाम में मार्क्स कम आना वो उसके लिए बहुत बड़ा फेलियर हो सकता है, किसी और क्या है ठीक है ना, छोटी मोटी बात है. और किसी के लिए शॉपिंग में कोई चीज सस्ते में ना मिले तो वो एक बड़ी बात होगी, और किसी के लिए अरे ठीक है ना यार ये नहीं तो दूसरी दुकान पे चले जाएंगे. तो हर इंसान उस पर्टिकुलर इवेंट को अलग अलग तरह से इंटरप्रेट करता है. सो हम लोग को सामने वाले के नजरिए को इंपॉर्टेंस देना है. दैट इज व्हाट इज रिक्वायर्ड सो दैट वी कैन प्रोवाइड सपोर्ट. और यहाँ पे मेंशन किया गया है कि आप लोग फ्रेंड्स को हेल्प कर रहे, बट इट इज नॉट अ सब्स्टिट्यूट फॉर प्रोफेशनल हेल्प. The idea is helping the family, friends, etc. of the individual to identify early signs of mental illness and help the individual get medical or professional help. काफी बार हम लोग सोचते हैं यार मैं सबके प्रॉब्लम सॉल्व कर देता हूँ, किसी को लव में इश्यू हो गया, किसी को ये लाइफ में फाइनेंशियल इश्यू हो गया और मैंने वो उसका सॉल्व कर दिया, और वो अज्यूम करे कि मैं साइकोलॉजिस्ट हूँ. तो नहीं, देयर इज अ डिफरेंस बिटवीन गाइडेंस एंड काउंसलिंग. अगर आप लोग गाइडेंस और काउंसलिंग को डिफरेंशिएट नहीं कर सकते, मतलब आप लोग समझ लो कि आप लोग गाइडेंस ही प्रोवाइड कर रहे हैं. ये प्रोफेशनल एक्सपर्ट ही बता सकता है कि गाइडेंस क्या है एंड काउंसलिंग क्या है. काउंसलिंग इज टोटली डिफरेंट, इट इज डन बाय प्रोफेशनल एक्सपर्ट. सो ये जानना जरूरी है कि आप लोग जो कर रहे हो, यू आर एक्टिंग एज अ इम्पोर्टेंट मीडियम. वो मीडियम है जिससे आप लोग उसको हेल्प करोगे टू गेट हिज बेस्ट ऑफ द मेंटल हेल्थ. बट डू नॉट अज्यूम कि हम लोग एक जो बातें कर लेंगे उससे प्रॉब्लम सॉल्व हो जाएगा इंसान का. माइनर इश्यू इट्स ओके, अदरवाइज मेजर इश्यूज में यू माइट डू मोर हार्म. सो इसको हम लोग बोलते हैं पेप टॉक करना, कि मैंने पेप टॉक कर दिया उसको मोटिवेट कर ले, बट ऐसा नहीं होता, बिकॉज काउंसलिंग इज अ प्रोसेस. गाइडेंस इज गिविंग डायरेक्टली अ सॉल्यूशन, उसको बोलते हैं गाइडेंस. People with mental illness do not always seek help. That is another major obstacle. तो स्टिग्मा है, शेयर नहीं कर, शेम फील करते हैं, रिस्पॉन्ड लोगों को नहीं पता, एंड जिनको इलनेस है वो लोग खुद भी ओपन होके बात नहीं करते. It is seen that very often people with mental illness will not go to a mental health professional for treatment. Number of reasons. Some can be culture. In our culture, behavior of an individual is considered to be a reflection of one's family. एक कैसे बिहेव करता है उसके फैमिली का रिफ्लेक्शन है. The stigma attached to mental illness prevents individuals from seeking professional help, as it might hurt the reputation of the family. किसी के mental health को reputation से correlate कर रहे हैं, तो ये correlation कितना गलत है. ये zero correlation है. हम लोगों ने correlation एक चैप्टर में पढ़ा था. Zero correlation. There is nothing related with mental health and reputation. आपको एक सिंपल सा एग्जांपल मैं बताता हूँ मेरे पर्सनल लाइफ से. मेरे लाइफ में एक ऐसे प्रोफेसर थे जहाँ पे अगर वो क्लास में एंट्री करते और हम लोग विश ना करें गुड मॉर्निंग तो भड़क जाते थे और बोलते बस तुम्हारे माँ बाप ने यही सिखाया है, तो डायरेक्टली यार फैमिली पे चले गए. ये कोई थोड़ी घर पे ट्रेनिंग मिलने वाला है कि यार गुड मॉर्निंग करना. ये तो हम लोग ऑब्जर्वेशन से सीखते हैं कि ऐसा करना है. और काफी बार कॉलेज वगैरह आने के बाद थोड़ा एटीट्यूड अपना आपका चिल आउट हो जाता है. सो हाँ, ये रॉन्ग अप्रोच है स्टूडेंट का, ये विश ना करना. तो वो अवेयरनेस में लाना है. अवेयरनेस में लाने के लिए हम लोग को बोलने का जरूरत नहीं है. एक पर्सन का बिहेवियर ही ऐसा होना चाहिए कि सामने वाले उठ के विश करे, वैसा तो ऐसा होना चाहिए. और नहीं भी हो कोई उठ के तो वो डिसरिस्पेक्ट से कोरिलेशन नहीं करना. तो ये जो ये प्रोफेसर का ऐसा एटीट्यूड था, जैसा बोलते थे तुम्हारे माँ बाप ने कुछ सिखाया नहीं है, उन्होंने कुछ मैनर्स नहीं सिखाए, तो ये एक रॉन्ग नोशन है इन जनरल इन सोसाइटी. सेम में यहाँ पे भी वही चीज है, ये रेप्यूटेशन से कंसिडर किया जाता है. इट इज अ रिफ्लेक्शन ऑफ द फैमिली, जरूरी नहीं है. Advice from elders. Many a times we look to our elders for advice to solve our problems. People might incorrectly believe that advice and guidance of elders alone will be sufficient to cure mental illness and do not feel the need to go to a mental health professional. So guidance है, counseling नहीं है. Counseling is done by a professional expert who has prepared himself and वो पूरा knowledge acquire किया है, different type of personalities को study किया है. That's a professional expert. And superstitions. Individuals who believe that mental illness is caused due to sins or due to supernatural forces are less likely to go to a medical professional. They do not think uh, the illness can be treated by modern medicine and psychotherapy and prefer going to untrained professionals. First aid in mental health is a concept which is based on the idea of prevention is better than cure. Mental illness usually does not develop out of the blue. Often there are small or subtle changes where the individual feels like something is not right. People around them might also notice a change in their thinking, feelings, or behavior. If these early signs are recognized, it can help in the following ways: diagnosis, intervention, and relapse prevention. Diagnosis, it might prevent a severe form of the illness from developing. Intervention, it can help the individual to get help, which is known as early intervention. Relapse prevention, it can prevent the reoccurrence of the symptoms of the illness if they occur after a period of improvement. तो ये सब हेल्प होगा अगर हम लोग मेंटल हेल्थ को फर्स्ट एड की तरह यूज करना शुरू कर दें. और ऐसे Chennai has obtained an international license in the year 2017 to carry out MHFA, Mental Health First Aid Program across India. Since then, it trains thousands of MHFA instructors to reach out to people suffering from mental illness. और सबसे important जो अभी आंसर आ रहा है, that is the LG model action plan. Be the difference in someone's life, apply LG. So LG model में क्या बोला गया? Ali is 19 years old and the captain of the cricket team. He was popular among his classmates and well liked, but for the last month he had stopped interacting and going out with his friends. Behavior में change आ गया. He would rarely respond to text messages or answer calls. He had suddenly broken up with his girlfriend after an argument and now he feels very guilty about it. ये guilt होना, हमने इसे पढ़ा अगर वो बहुत long time के लिए चले तो एक depression का sign हो सकता है. Ali was having difficulty sleeping, concentrating in college. Ali had lost lots of weight in the past month and he looked tired and irritated. Definitely a depressive signs की तरफ जा रहे हैं. और ये हम लोगों ने mention किया था कि 2 weeks से ज्यादा हो तो ये depression case हो सकता है. As a captain of the team, he had always been calm, but during a match when his team was losing, he fought with the umpire. Due to his behavior, he was asked to leave the field. His best friend Rahul had noticed all these behavior changes happening over the past month and was concerned for his friend. He wanted to help him, but did not know how to respond. So, how should Rahul should help? तो वो अभी technique यहाँ पे discuss किया. So in this section, we are going to see one of the methods that can be used as a part of first aid in mental health to help someone you think is in need. After reading the next section, see if the answers you gave for the above scenario are similar. मतलब ये जो राहुल का केस था उसमें आपको अली का केस था वो आपने सही तरह से हेल्प करने का सजेशन दिया है. Often we have an image in our minds that someone suffering from mental illness will behave or dress in a certain way, talk to themselves, be violent, wear torn or dirty clothes. However, in majority of the cases, individuals with a mental illness will appear just like someone without a diagnosed mental illness. तो पता भी नहीं चलेगा, हम लोग differentiate नहीं कर पाएंगे. Their behaviors initially might appear just like someone without their behaviors initially might appear to be different from how they usually behave, only to close friends and family members. जिनको उनका pattern of behavior पता है, as in Ali's case. If these early signs are recognized as being a red flag, that is something to be concerned about. The steps can be taken to try and prevent from becoming bigger, and that is LG model. LG model के हिसाब से ALGEE stands for A से approach, L से listen, G से gives supporting information, E से encourage for professional help, encourage for self-help and support strategy. So approach, assess and assist in any crisis. तो पहले approach करके जानना है कि पहले कुछ problem है या नहीं है. शायद problem है ही नहीं, वो अपने disturbance को अच्छे से manage कर पा रहा है, तो that's okay. But assess करना जरूरी है. Approach, assess, assist in any crisis. Listen non-judgmentally. इतना जजमेंट मत लो, अरे यार ये तो बहुत छोटी बात है, लाइफ में मेरे साथ ऐसे हो गया, मेरे तो बहुत ब्रेकअप हो गया, अरे मैं भी एग्जाम में फेलियर हुआ था, ये तो बहुत छोटी बात है, बड़ी बात है नहीं. लिसन टू द पर्सन नॉन जजमेंटली, यू विल गेट लॉट ऑफ क्लैरिटी कि उसके थॉट प्रोसेस कैसे जा रहे हैं. गिव दी सपोर्टिंग इंफॉर्मेशन कि क्या चीजें उसको हेल्प कर सकती है. एनकरेज अप्रोप्रिएट प्रोफेशनल हेल्प एंड एनकरेज सेल्फ हेल्प एंड अदर सपोर्ट स्ट्रेटजीज. सो दैट इज द LG action plan. Approach, assess and assist. I don't know what to do. Let me ask Neha and Saket if they know what to do. Saket and I agree with you. We have also been thinking that Ali's behavior is odd. Ali, we have noticed some changes in your behavior. Please tell us if there is anything you would like to discuss. बहुत ही अच्छे से उन्होंने अप्रोच किया, असेस किया और असिस्टेंस के लिए उन्होंने अपना willingness दिखाया. It is a common tendency to avoid things that make us uncomfortable, like talking about feelings. हम लोग बोलते पता नहीं यार क्या महसूस, बस पता नहीं यार, नहीं बात करना है. We find it difficult to reach out to people who are in distress, as it makes us uncomfortable. हम लोग तो ये टॉपिक पे बात करेंगे ना तो शायद वो डिस्टर्ब हो जाएगा, तो ऑलरेडी डिस्टर्ब है. एक्सेप्टेंस डेवलप करना. We stay quiet out of fear of offending the other person, और ऐसा डेफिनेटली होता है. Here Rahul could have done nothing or just gossiped about Ali's behavior, but instead he has used the concern he feels positively to try and help Ali. Rather than being a mute spectator, approaching the person you are concerned about what will be helpful. Though the term used is assessment, we are not referring to use of any psychological test. It can be based on assessing the individual behavior through observation. Here an attempt is made to understand the situation and notice if there are any behavioral changes in the individual. So approach, assess and assist. Listen non-judgmentally. I know that the umpire wanted my team to lose, so he purposely gave me out. I think the umpire was fair during the game. I feel if I tell him that this behavior is childish, he might feel criticized. Saying this will not be helpful. Instead, I will say, I can see that you are upset that your team lost. I would also feel bad if I was in your situation. तो उसके feelings को respect करके समझना है. Listen करना है non-judgmentally. ऐसा नहीं बोलना है बच्चे ऐसे कर रहे हैं. Many a times, though we are trying to help, our responses can be damaging. Often this happens because we say things that make the individual feel guilty about how they are feeling, sorry for themselves or helpless. Listening non-judgmentally means that you listen to the other person without letting your own views, biases, opinions influence you. You don't have to be subjective right now. While listening, we must ensure not to criticize, as it makes the other feel judged and they become defensive and stop talking. Listening non-judgmentally does not mean you agree with what the other person is saying. It means that you are showing them empathy and are accepting them. You are trying to see their world from their point of view. ये काउंसलिंग का बहुत इंपॉर्टेंट रोल है. तो डेफिनेटली आप लोग काउंसलर नहीं हो, बट काउंसलर के क्वालिटीज कुछ डेवलप कर पाओगे अभी से. You show that you understand that they are currently struggling with certain situations. When we are able to listen non-judgmentally, the other person feels supported and speaks more freely. वो open up होगा, वो share करेगा और ऐसे ही उसमें acceptance develop हो पाएगा. तो पहला था A, approach करना है. दूसरा L, listening non-judgmentally. Give support and information. So I have ruined my life. My studies have gone for a toss. I've broken up with my girlfriend. My coach wants to remove me as a captain. I'm a loser and my life is worthless. And यहाँ पे फिर एक friend जो बता रही है, I understand that you're feeling sad. I believe that you'll not feel the same way for the rest of your life. पूरी जिंदगी ये emotion नहीं रहेगा. It will pass by. We all experiences the setbacks and failures, but that does not mean that we are losers. Remember that you are a worthy person. उसको अपना self-worth increase करने में help कर. Listening to what you all had to say, I am feeling better and hopeful. Offering genuine support to someone shows them that they matter. Individuals who receive support feel more in control of the situation. It reminds them they are not alone. उनको support देना, तो give support and information. Then encourage to get professional help. We all think you should go to the counselor, college counselor. No, I can handle my own problems. If others find out, they will think I am mad and I'm calling me a loser. मुझे पागल समझेंगे. तो वही stigma, shame. We will all come with you to the counselor. It is possible that some of our classmates will make fun of you. What if you do not focus on that and instead think about how you will feel better? सब friends आके उसको support करें. In your last year's textbook, you already have studied that work done by counselors and clinical psychologists. Just as we go to a doctor when we feel sick, likewise, we should not hesitate to go to a mental health professional when we are dealing with a mental health issue. Mental health practitioners are trained, thus they can help individuals to identify their problems. They also help the individual cope with that particular situation. So that is the quality of a trained professional. Encourage self-help and other support strategies. So ये सब self-help भी encourage करना है. You can also talk to your parents and elder brother. कुछ books suggest कर सकते. We'll meet every evening in the park and go for a run. The days when you don't feel like exercising, you can just sit and chat. तो ये activate करना है person को. To encourage करना है self-help and other support strategies. So in addition to professional help, making the individual aware of other ways to deal with a difficult situation is important. Having social support, that is the support of loved ones, can be healing. इसीलिए ऐसे सोशल ग्रुप्स भी होते हैं जहाँ पे वो पर्सन अकेला ना फील करे और सोशल ग्रुप में प्रॉपर काउंसलिंग भी होता है. सेल्फ हेल्प स्ट्रेटजीज refer to tasks that you can perform yourself. These are tasks that help maintain your mental health. This will increase your resources to deal with stress. Refer to box number 3 for some suggestions of strategies that you can incorporate in your daily life. Mental health first aid में आप क्या कर सकते हैं? Sleep hygiene, 7 to 8 hours of sleep, same schedule every night at the same time, wake up at the same time and undisturbed sleep. Reduce screen time and digital involvement. और अभी तो जब से ऑनलाइन एजुकेशन हो गया तो स्क्रीन टाइम बढ़ गया, बट ट्राई टू डिस्कनेक्ट एवरी नाइट एट वन पर्टिकुलर टाइम. आई जस्ट keep my cell phone aside, silent way, while I'm having food, while I'm praying. I don't want any kind of disturbance. I want to give time for my spiritual development, for my mental health. Physical activity add karna, engaging activities that you enjoy, cultivate hobbies, favorite songs sunna, build and maintain social support. फर्स्ट एड इन मेंटल हेल्थ कि क्या हम लोग डिप्रेशन और एंजाइटी के लिए सजेस्ट कर सकते हैं. सो फर्स्ट इन डिप्रेशन, व्हाट आर द रिस्क फैक्टर्स ऑफ डिप्रेशन? अगर फैमिली हिस्ट्री है, एग्जाम प्रेशर है, प्रॉब्लम्स विद फ्रेंड्स, बुलिंग, ब्रेकअप ऑफ अ रिलेशनशिप, अनरिजॉल्व्ड ग्रीफ फ्रॉम चाइल्डहुड, एक्सपीरियंसिंग इमोशनल प्रॉब्लम्स, तो ये सब रिस्क फैक्टर्स है जिससे डिप्रेशन डेवलप हो सकता है. We all feel sad or unhappy from time to time, but in most cases, when our situation changes, we no longer feel this way. However, if we continue to experience these emotions for a long period of time, then it might require attention. If unattended, this can lead to the development of a disorder such as depression. Individuals who experience depression commonly have negative thinking style with themes of hopelessness and helplessness. They may say things like, I'm unlovable, things will always be bad, I'm worthless, I'm a failure, nothing will ever change, no one can ever help me. तो उसमें ये एक नेगेटिव ट्रायड बोला जाता है. नेगेटिव ट्रायड, एक साइंटिस्ट है जिन्होंने ये एरन बैक करके जिन्होंने दिया था, नेगेटिव सेल्फ ऑफ द नेगेटिव व्यू ऑफ द सेल्फ, खुद के बारे में गलत सोचना, नेगेटिव व्यू ऑफ द वर्ल्ड, दूसरे लोग भी बुरे हैं, एंड नेगेटिव व्यू ऑफ फ्यूचर. तो ये तीनों चीज आपको याद रखना है. ट्रायंगल जैसा आप लोग बना देना. सेल्फ के लिए I'm unlovable, I'm worthless, I'm a failure. Negative view of the self. Things will always be bad. Negative view of the future. Nothing will ever change. Future के बारे में, no one can ever help me. World के बारे में भी negative. तो negative view, it's a triad. So negative thinking style develop होता है. तो as you can see, ये trained professional को ये concept पता होगा. अभी आपको भी पता है because you are getting the training which is required to become the future psychologist. Some of the changes in the behavior of individuals suffering from depression: complain of feeling tired all the time and sleep more than usual, not doing household chores or forgetting to do in spite of telling them, withdrawing from the family, spending much time alone, isolation, getting aggressive, especially seen in boys, continuously remain sad, performing poorly in exams, bunk the class or remain absent, have difficulty in understanding what is taught in the class, avoid friends, spend time alone, engaging in risky behaviors like alcohol and drug use. तो ये सब हम लोग डिप्रेशन के साइनल सिम्टम्स पढ़ चुके हैं, जहाँ पे हमने याद रखा था हैज गिल्ट. तो गिल्ट क्रिएट होना, होपलेस होना, एंजाइटी होना, एक्सट्रीम सैड होना, ये कुछ सिम्टम्स होते हैं. और बाकी सारे बहुत सारे सिम्टम्स है. काम ना करना, कंसंट्रेट नहीं कर पाना, नींद ना आना, खाना ना खाना, आइसोलेट करना, दीज आर ऑल साइंस ऑफ डिप्रेशन. सो ऐसे कुछ एक्टिविटी दिए हैं कि जिससे आप लोग एंजाइटी को रिड्यूस कर सको. So one strategy that we can use to calm down is the 5-4-3-2-1 technique. This is a simple technique that you can use whenever you are feeling overwhelmed by a situation and need to relax. First, take a few deep breaths and follow the instructions. ये definitely help करेगा when you are anxious just before your exams. तो इसको बोलते हैं mindfulness activities. Being mindful of, you are filling your mind with certain things. Think of 5 things that you can see around you. Observe करो. तो मैं अगर छोटी चीज को ऑब्जर्व करूँ तो माइनर चीज, ओके, यहाँ पे एक बेल्ट रखा है, यहाँ पे एक छोटा सा, यहाँ पे कॉइन रखा है, यहाँ पे कर्टन है, फैन है, वॉच है, 5 चीजों पे फोकस कर. एग्जांपल पेन, बुक एक्सेट्रा. थिंक ऑफ 4 थिंग्स दैट यू कैन टच अराउंड यू. फॉर एग्जांपल योर हेयर, उसका फीलिंग हम लोग को एक्सपीरियंस करना है, टच नहीं करना है. ग्राउंड अंडर योर फीट, कैसा फीलिंग है. तो यहाँ पे टेबल है, वो टेबल कैसा है, तो रफ है. हेयर कैसे, तो स्मूथ है. फिर यहाँ पे मैं अपना स्किन को भी फील कर सकता हूँ, टेक्सचर फील कर सकता हूँ. 4 things you can touch. Think of 3 things that you can hear around you. I can hear the sound of the fan. I can hear some noise of the vehicles. I can hear my sound. तो ये 3 चीज पे मैं कंसंट्रेट करूंगा, मैं फोकस करूँ. फॉर एग्जांपल साउंड ऑफ ट्रैफिक, साउंड ऑफ पीपल हु आर टॉकिंग. तो ये 3 things you can hear. And then is going to be 2 things that you can smell around you. For example, the scent of soap from your hands, the fragrance of your deodorant. Think of one thing you can taste. For example, the taste of the last meal that you had. कोई भी चीज मेरी जैसे फेवरेट चीज है, दाल खिचड़ी है, फ्रैंकी है, चाइनीज है. So performing this exercise will help you focus on the present and stop worrying. तो हम लोग ने हमारे माइंड को उस थॉट से निकाल के कुछ स्पेसिफिक गाइड किया है. इसको बोलते हैं गाइडेड रिलैक्सेशन, माइंडफुल एक्टिविटीज. So ये डिप्रेशन के लिए हेल्पफुल होगा. First aid in anxiety. Feeling anxious in certain situations is normal. However, if your anxiety is not in the proportion to the situation, or if it continues even after the anxiety creating situation has subsided, it's a matter of concern. If unchecked or not treated, such type of anxiety can reach the extent of anxiety disorder. जैसे हमने पढ़ा है कि अगर 1 महीने से ज्यादा रहे तो वो anxiety disorders में क्लासिफाई किया जाता है. एंड अगर 6 months से ज्यादा हो adults में, and 4 weeks, 1 month से ज्यादा हो children में, then it is classified as an anxiety disorder. Some factors contributing to anxiety are genetic factors. अगर family history है तो definitely high risk हो सकता है. Brain chemistry, neurotransmitters ऐसे कुछ imbalance हो रहे तो anxiety feel होना obvious है. Traumatic event like abuse, rape, sudden death of any of the parent, usually anxiety से बाद में post traumatic stress disorder की तरफ जाएगा. Parental divorce, stress about college exams. So anxiety can be a matter of concern when it starts affecting and interfering with functions of daily life of the individual. तो आपको पता है anxiety का definition था, the person feels worried without any obvious reason and starts to interfere with normal life. The obvious reason पता नहीं है and starts to interfere. There are different types of anxiety disorders like social phobia, separation anxiety, acute stress disorder, generalized anxiety disorder हमने पढ़ा था. तो ये सब या फिर एग्रोफोबिया, social situations. In general, the symptoms of anxiety are as follows. There are physical symptoms, psychological and behavioral symptoms. Physical, heart palpitations, rapid heart rate, shortness of breath, dizziness, headache, restlessness, tremors, and shaking. Psychological, mind racing or being blind, difficulty in concentration, forgetfulness, problems in decision making, irritability, impatience, anger. Behavioral symptoms, avoiding people and situations, repetitive checking, strong urge to escape the situation, वो चीज को avoid करना, escape करना या बार बार check करते रहना. Individuals who are anxious may not want to go to college or work, complain repeatedly of various physiological problems, get irritated while interacting with the friends or family, spend a lot of time worrying, be extremely quiet in the class or at work, or get scared of asking questions to teachers or colleagues, sometimes ask the same questions repeatedly. They visibly show the physical symptoms of anxiety like sweating or excessive worry. So ये पर्सनल रिस्पॉन्स है, इसके लिए मैं फास्ट रीड कर रहा हूँ. खुद से आप लोग मन से अच्छे से लिख पाओगे एंजाइटी के ये क्या सिम्टम्स रहेंगे. नाउ वी हैव सीन व्हाट काइंड ऑफ थॉट्स एंड बिहेवियर्स ऑफ इंडिविजुअल्स डीलिंग विद डिप्रेशन एंड एंजाइटी एग्जिबिट. लेट्स ट्राई हाउ दे कैन बी हेल्प्ड. सो द एक्शन प्लान फॉर प्रोवाइडिंग फर्स्ट एड वाज डिस्कस्ड. तो हम लोग स्टेप 1 फॉर डिप्रेशन एंजाइटी. If you see your friend showing symptoms that they are mentioned above, and if you feel that there might be a chance of the person harming himself, the first thing to do is meeting his or her close family members and sensitizing them about the seriousness of the issue. Also, you can approach a mental health professional along with family members and discuss your concerns. First, क्या गया LG model के हिसाब से approach करना है, assist करना है. Then you can give a friend a patient hearing and understanding that neither he or she is behaving like that purposely or he or she is weak. Listening non-judgmentally. तो LG model का ही action plan लिखना है. Instead, he or she is suffering from a problem and needs a compassionate hearing from someone. Remember, you should neither criticize your friend while listening, nor should you make any harsh comments. Sometimes the person may experience shame or feel guilty. In such a situation, you can help the person by giving hope and making them realize that to give support and information. Hope देना है. Many people are diagnosed with mental health disorders. Having mental illness is not their fault. One may take some time to get better with the help of a proper mental health professional, but is certainly curable. As mentioned in step 3, depression and anxiety are cured with proper scientific treatment by a mental health professional. So, encourage to take professional help. You can support, encourage, and even accompany your friend to see a counselor or a psychotherapist. Getting the person proper professional help in mental health care is the key to dealing with mental health issues. Last one, encourage for self-help. You can help the person identify some of the positive behaviors which can help them to cope with their mental health issues. They can engage in the activities which they like or which they always wanted to pursue. Performing self-help strategies can also help them regain control over their life. So using encouraged for simple relaxation like using laughter, comedy की चीजें देखना, enjoy करना, music सुनना, deep breathing techniques, exercise like walking or running or playing outdoor games. So seeking professional help is very crucial in anxiety and depression. So encouraging a person to reach out for professional help is most important. तो कितनी बार ये point repeat किया गया है, ये important है. Then 4-7-8 breathing. So exhale completely through your mouth. Close your mouth and inhale through your nose for 4 counts. Hold your breath for 7 count. Exhale completely through your mouth for 8 counts. 4-7-8. Inhale for 4 times, hold for 7 and release for 8. So ये mind को fill भी कर रहा है. Breathing is very important. Oxygen is vital. This is one cycle. You can repeat cycle 3 more times. With practice, it will get easier. 4-7-8. Starting में difficult लग सकता है, but 4 नहीं हुआ तो 3 कर लो, 7 नहीं हुआ तो 5 कर लो. इसके लिए stress नहीं लेना है वापस से. Final parts, certain behavioral issues like alcohol or drug हो, but similarly ऐसे भी कुछ issues होते हैं which are called as behavioral addictions like shopping addiction, internet addiction, excessive usage of media, exercise addiction, gambling addiction. अगर वो behavior dependence develop करे then it's an addiction. These behaviors are not considered to be a mental disorder according to DSM-5, but they can still be a cause of concern. When an individual gets addicted to such behaviors, the following is seen. They are unable to stop performing such behaviors as they find them to be rewarding. It makes them feel happy or excited. तो जैसे tobacco का addiction हो, smoking का addiction हो, porn addiction हो, gaming addiction हो, first वो उससे pleasure derive करना है. It adversely affects significant relationships in their life. तो वो पूरा टाइम उसी चीज में लगे रहेंगे और दूसरे लोगों को टाइम नहीं देंगे या उसका भी एक इम्पैक्ट होगा, कॉन्सिक्वेंस होगा ये सब चीजों के एडिक्शन का. They experience negative consequences due to constantly engaging in such behaviors. Time wastage होगा, energy wastage होगा, proper से उनका thought process नहीं चलेगा. So shut करके एक activity है, service for healthy use of technology. Service for healthy use of technology is a clinic started by NIMHANS, National Institute of Mental Health Service in Bangalore. This clinic has been started to deal exclusively with technology related mental health issues. तो shut करना है ये technology usage को, कम करना है. So a 26-year-old unemployed man who has been referred for treatment because of was addicted to watching Netflix. For our last 6 months, he had been watching online television serials on Netflix for most of the day. The psychologist, after interacting with him, found that he was using this online streaming as a way to escape from reality. उसने एक displacement develop कर लिया था वो issue से. So he was unable to deal with the pressure that his family was putting on him to earn a living. Watching his friends doing well while he wasn't also had a negative impact on him. He was unable to exercise self-control. Nowadays, using the internet is essential. Internet is not the problem. How we use it and for how long we surf the internet every day is what leads to problem. While the amount of time we use the internet can be of concern, what we are using it for, that is also a concern. Example, online gambling, gaming, pornography. In the above examples, we saw an extreme real-life example of what being addicted to the internet can look like. Just a Netflix guy. Most of the time, people do not need to get professional help, but their over-dependence on the internet can lead to problems in life. So, self-assess कैसे करें कि आपको कोई addiction है कि नहीं? Use the 4 C's. Craving. Do you have an intense desire to use the internet? ऐसा लगता है यार नहीं मुझे WhatsApp देखना ही पड़ेगा, Insta देखना पड़ेगा, Facebook देखना पड़ेगा, Netflix, Amazon. तो ये craving अगर है जिसको आप control नहीं कर पा रहे तो addiction develop हो रहा है. Control. Do you have an inability to control yourself using the internet? अगर मैं बोलूँ अभी 1 घंटा मत use करो. Are you able to keep some time apart? Are you able to control that behavior? Compulsion. Do you find it difficult to stop using the internet? You know you should not spend so much time on it even though you know. पता है फिर भी time wastage हो रहा है. Consequence. Have you ever experienced any physical or psychological ill effects as a result of excessive use of internet? If you answer yes for at least 3 of the C's, it can be a matter of concern. Okay. If there is craving, if there's a control issue, if there's compulsion, if there's consequence, psychological effects are that's a concern. Some of the red flags on over dependence of the internet are procrastination, time wastage करना, boredom with routine tasks, no sense of time, time ऐसे चला जाता है, feelings of euphoria when using the internet, बहुत pleasure derive करना, inability to prioritize or keep schedules, failing to eat or eating excessively to avoid being away from the computer. Symptoms, physical symptoms like headache, neck pain, dry eyes, backache, poor personal hygiene, not having a bath to stay online. If you notice that your friends are showing the red flags, you can adopt some of the measures that have been mentioned. वही LG model आप लोग suggest कर सकते हैं. With the strategies and techniques discussed in this chapter, one can provide some simple yet important first aid to the person showing signs and symptoms or red flags of psychological problems. When these go undetected for a longer period of time, it results in a bigger psychological problem. So एक psychological problem हो सकता है. तो mainly तो psychological help के लिए encourage करना. One thing you should never forget that such psychological issues can be treated only by a mental health professional and not by a layman. Again, आपसे repeat किया है. You can only be the bridge. मैंने बोला था आप एक mediator हो between the person and the mental health professional and can encourage the person to seek professional help. Providing the person first aid in mental health issues is just as important as in the case of physiological issues, and it can at times be life-saving. So this was the detailed discussion about the mental health first aid program. Important चीज आपको याद रखना है LG मॉडल. ये याद हो गया तो कोई भी टाइप के क्वेश्चंस को आप लोग अच्छे से अटेम्प्ट कर पाओगे. So in the next session we are going to discuss the last chapter of 12th standard psychology. Stay tuned. That's all from Dipenism.